Okay.
All right, Mario. So it's starting to record. I'll kick it off a little bit. Hey, and then Mario. Hey, we're on a new podcast today. Today we're going to be talking about sciatica and the complications with that. I got Mario here. We've decided to chit chat and discuss the issues. Kind of laid back.
Sciatica,
a little bit.
Alex.
Sciatica. Yeah, sciatica is an amazing thing.
Yeah, it sounds very painful.
Let me ask you this: in your practice, Mario, in terms of working with sciatica, what have you learned over the years in terms of sciatica?
Sciatica will put you down, Alex. Will make you feel like a baby, and make you remember how important chiropractic is and maintenance. It's like having that car, that Bugatti, and you drive it, you do no maintenance on it, you just put gas and you just like rip it and run it. And then one day, okay, it leaves you hanging in the middle of I-10 and everyone's passing you and you're embarrassed.
It really is.
That's what sciatica is. It's embarrassing.
I believe it's kind of funny that we're laughing at it, but it is a scourge, I call it, of the low back. It literally catches you off surprise. It creeps up on you. It looms around you.
Yeah.
And when it bites you, I mean, classically defined as pain going down the leg. There's a lot of reasons why that happens. But what do you get when your patients show up with that? What do they tell you? What kind of symptoms do they kind of present?
Oh, you got to be kidding me. You know what? First of all, their wife drives them in. Does that tell you what it is? Yeah. It's like a knife stabbing them in the back, and it radiates all the way down their leg, and then they're usually leaning to one side or another.
Yeah.
And then they have this story, Alex. They have this crazy story like, well, I was the only part is ridiculous. I was only, picking up my child, or I was only throwing a football, and all of a sudden my back went out.
Right.
And then I try to like stretch it, and I try to like have my wife rub it, and all of that didn't work.
Yeah.
The next morning, couldn't get out of bed.
Exactly.
I had to crawl to the bathroom. Now that is when your attention is on
sciatica.
Yeah,
right?
On sciatica. So, so this is it. This is a big topic, Alex.
This is a huge topic. And let me just kind of throw this out there. We're going to begin the process of breaking down sciatica. By no means are we going to be able to even the breadth and width. This is like saying you can take down a sequoia with one bite. It's not going to happen.
A pocket knife.
We're going to have to chisel away from it, and as we go in it, we're going to go deep. We're going to get nasty, huh, Mario? We're going to get nasty with the science.
This is getting deep and nasty. Folks will have to strap on their seatbelts for this ride, baby.
Absolutely. And as we do that, we're going to be able to kind of go deep into it. We're going to touch on subject matters, but follow us on this process because we're going to be discussing real important matters pertaining to sciatica that affects so many millions of people at any given point. I'd venture to say that 1 in every 4 persons is suffering from chronic back pain.
Yeah.
And half of those people are suffering from sciatica in some sort of form or the other, or some sort of pain down the leg. So in that sense, we're dealing with a huge issue that affects millions of patients and millions of people across the country with all different doctors, with all different types of protocols. And these protocols can be from really esoteric to really invasive. And we all want to do it easy. We all want to do it a simple way. So I think modern medicine, Mario, has determined that we have to go basic and we have to try everything before we do any surgical interventions. When you work,
it's common sense.
It's I
mean, it's common sense. It's like I always use the car model. Before you get a rebuilt transmission, why don't you do maintenance on it?
Exactly.
Before you drop a new engine, why don't you change the oil and get a tune-up? Mm-hmm. And unfortunately, again, you mentioned the unbelievable impact of low back pain in our society. Okay, in our society, I believe, I don't know, I may be in the ballpark, it is the number 2 or 3 reason for work injuries. It is the one of the biggest reasons for military to get med boarded out of the military. I mean, this is a big issue that impacts people's lives. And then we get into chronic pain management, things like that. But again, if we really look at what is the solution, the most critical solution in our life is prevention. And what is prevention? Prevention is natural utilization of therapeutic arts that decrease the misalignment in the spine. And again, that misalignment is that torque. That torque. Your back being out of alignment, out of calibration, right? Which causes uneven wear and tear on the disc.
Exactly.
Okay? And then the other one is constant compression, sitting down, right? Sitting down, repetitive motion. And the other one is just injuries. Just like more and more young kids are getting injured. Sports, football, basketball, more intense, more torque. And you can see pro basketball players, football players, all of them suffer from what?
Sciatica.
Yeah, back pain. Absolutely.
And here's the cascade. The cascade starts with a decalibration of the pelvis or the hips or some sort of injury, trauma, some space-occupying lesion, something on his path. I'm going to go ahead and demonstrate here on our pathway here. We're going to show a little bit of what actually is in the nerves. Okay, so this is the...
I love this 3D, Alex.
Yeah,
this is good stuff.
Complete Anatomy provides this for us, and what we can actually see is a three-dimensional aspect of how and why someone has sciatica. Now, when you look at this, Mario, what's your first take? Because for me, it says it's a complicated structure when we're looking at this. When you look at the back where it comes out, where you actually, and this yellow thing, this big old cable is called the sciatic nerve. But you see so many proximal areas and so many regions that are getting
a lot of moving parts, Alex.
A lot.
A lot of moving parts, baby.
Yes, it is. And you know what? One of the crazy things that I'm looking at here is that this
sacrum.
That's the sacrum. Okay, and when
that's a base.
That's the foundation. The way the Creator created us was that this is the place where energy transmits. This bone right here, the sacrum, right? But little to the front of it, you have the sacral nerve roots that come out. As they form out, you can actually see on this particular area, you can actually see the nerve roots coming out. And as they come in posterior aspect, you can kind of turn this around, and I'm going to turn this around. All right, so we kind of get this little area here. And as we do this, as we rotate this thing, we can actually see the sciatic nerve, okay, as it comes out of what we call the sacral notch. That sacral notch is
right
huge.
There.
It's
right in there.
Exactly. So what happens is, oops, I kind of lost my computer. Hold on, let me get control of this guy
again. Crazy with this.
Yeah, I know, huh? So what happens is when you see it here, you can understand that this big old nerve actually influences the entire creature. You take this thing out, you have limited the creature's ability to move. Take a look at as it comes out. You can actually look from the inferior border to the superior border. You can actually see why a woman, when she's pregnant, you can actually determine why this baby that sits in this pelvic cavity here can actually cause a lot of damage to the sacral nerve. Okay, so
a lot of them suffer from what? Back pain and sciatica.
And this is one of the reasons why. Right here, that baby sits and dances in this whole area here. So when we look at this kind of stuff, we can make sense of all the presentations. Now, as you hurt a nerve in one area, you can actually see here that as you would do something like this, you would actually hurt, and the nerve will actually hurt a distal, or meaning towards away from it, once you hurt that region. Now, our goal here is to really be able to determine, actually, I don't know how to remove those lines, but you can actually see the nerve roots going down on that particular area. If this affects this all the way down the leg, it will cause pain. Now,
right there.
Right there, exactly. So you can actually see in this particular region what goes on. Now, I'm going to add some muscles here.
That's it.
Huh?
This is it. Now you see, this is what I like. It's very, very, this is a creation. If you believe in miracles, you stop believing and just realize that you're one walking. Here's the sacrum right here, the sacred bone. That's why it's called sacrum, because it's sacred. Okay. Then the ilium.
I didn't know that.
Yeah.
I learned
sacred.
The sacred bone. It is.
Yeah.
It is the base of the spine.
That's it. This is where, like you mentioned, this is where the birth comes out. This is like where the next legacy is created. So here is the ilium. Okay. So that's your hip bone. You have two of them. symmetry. There's a lot of symmetry in our bodies. That's how God created us, in symmetrical synergy. Okay? And then right here's a pubic symphysis, and then you've got the obturators right there, and then here is that L5 disc, and this is the one where I would say probably 80% of disc herniations happen right there. So if you just want to take a wild guess, this is it right here. It's happening right there. These are the facets.
Let me hone in on that right there so I can bring that in a little bit better. And as I'm going to try to bring it in here, let me try to do this. Okay, as we do this, well, let's go this way a little bit. Oops.
Man, this thing's dancing.
Yeah, it's dancing, baby. You can see. So as we kind of, so we kind of move it. He's talking about right there, the disc space. Show the disc.
Right here.
Uh-huh.
Okay, and see, that is where you have the IVF, vertebral foramen.
IVF, intervertebral
IVF. There it is. So all that is like a fancy word for it. There's a hole where everything comes out.
Let me show you them where the hole's at, or a hole. Yeah. Oh, you got it? Okay, we're kind of fighting here.
Oh, go ahead.
Oh,
do your stuff.
There we go. So here we start looking at the hole. Here's the hole on the side. And as I kind of have the best way to do is kind of go out, and then we go in, and then rotate it. So when we look at it right there, you can actually see where the nerve roots come out right there.
Yeah. Mm-hmm. So at that point, you see it here, right? Okay, it's kind of funky.
Just hold it there and just turn it. Mm-hmm.
Okay, good. Okay, right there.
Mm-hmm. That is the facets there, yeah.
So this is where how they sit on top of each other, right there. Okay, and then you can see it from underneath, right in there. You know what? I wish I could get a little bit better picture. But again, I think there you go. Okay. So now at this point here, so these nerves, these are like the fiber optics, just traveling down through these canals and openings and everything. So there's so many places, Alex, that they can be entrapped.
Yes.
They could be compressed. They can be twisted. Again, inflammatory. Remember, the big word for us in our talks is inflammation.
Inflammation. The inflammation doctors. That's what we got to
do. Deep inflammation. Nasty inflammation, to be correct. So now, these are all, again, if you're looking as an electrician looks, because I love this. This is like electrician work. You look at the fiber optics, and you have to trace it and find out where is the issue. Is it up here? Right here? Is it in the middle? Is it here in the canal? Right there in that notch? Is the muscle compressed? So if you look at it, you know what? If we can put some.
Oh yeah. Let me add some muscle here.
Yeah, go. Can you add that?
Let me take control there, and I can show you. Actually, from the moment you start adding more muscle here, we start looking.
Bam! Right there.
Right there. You see
where it's pinched?
Yep.
Right there.
Oh yeah.
Wow, that piriformis, baby. That P muscle.
Yes, sir.
Piriformis. Now, this is critical. Again, that's where you see a lot of times you need to release that muscle. Once it compresses, it just goes right there. It's like a scissor.
And bzzz, it happens.
Yeah.
Right? Hey, why did they call it the piriformis? You know that, Mario? Did you ever kind of wonder why they call it piriformis?
Tell me, Alex.
It's because it looks like a pear. Basically, when you take it, it's a fat muscle. When you actually it's kind of flat here.
I'm visualizing the pear, Alex.
Yeah, I know. Here's the top of the pear, and that's the wide part of the pear, so they call it the piriformis.
That's cute, Alex. I don't know what kind of pear that is, but it's you're right. It's pear shaped. Now, I can see it.
This is a crazy part. That's the superior scamelus right here in that area. So it can get entrapped anywhere as we
anywhere.
So as we look at this, and from the base point of view, you can see why people start having these symptoms. Go ahead, take care.
Yeah, and so this, Alex, if we look at this pattern, right, we can also see due to a increased sedentary lifestyle, Alex. Can you see how all of these muscles here, the glutes, gluteus minimus, maximus, the hamstrings. Look at that. Ooh, look at that. Major muscle. Squats.
Right there.
This is what I call the squats muscle right there.
Yeah.
And the hip. Can you see all of these being deconditioned and doing what? Compressing on the nerve.
Compressing. Exactly.
Yeah. Yeah.
Now, let me show you this, Mario, because I wanted to show you this. I thought this when I first started seeing this. If you start noticing here, you have the venous system. But here's what people don't know about the venous system. Next to it is the lymphatic system.
Yeah.
Now, let me remove these muscles here. Okay, kind of remove them. And you're going to see the intricacies of the green lines. That is the circulatory system. Okay,
wow.
right there.
That's lymph. The green is the lymph, Alex.
Exactly. The green is the lymph, and the red is arterial, right? And when you start seeing red, now you can see that when someone sits down a lot, they end up having problems with their circulation. And as you can see here, imagine sitting down all darn day on top of this thing, right? Can you see how the inflammation would actually happen on that nerve root?
Alex, look at how much is going on in that pelvic area.
That's right.
This is like fiber optics, like just strapped. Okay, this is like compressed already. There is not that much space going on here, Alex. I mean, you've got nerves, you got arteries, you got veins, you got lymph. All of those going through the same canal. Okay, so there is not a lot of what I call space and forgiveness, you know?
Yes.
There's not. I mean, then that's why this radiating pain down the leg, again, once you compress that area, that flow down the leg is totally activated, okay? And that's why your leg goes numb and your muscles, in a large extent, after a long period of time of having this problem, what happens, Alex, with a lot of my patients is they get muscle atrophy, Yes. They get muscle weakness, okay? And that's where your muscles actually shrink.
Let me show you the additional muscles here. What's going on? Let me take control of that for just a split second here so I can show you what's going to actually see. That's why we train, because all these muscles here are surrounding and covering up this area. If this butt, Mario, it turns into a decalibrated system. So we end up...
Decalibrate. Is that like a fancy word for saying it just like...
Deconditioned?
That flops down?
For me, I like the word calibration because it is a fine-tuned structure.
Yeah.
Philosophically speaking, when you look at humans, they got a bump. It's this ball that follows them everywhere.
Yeah.
It's this power unit, right? This throttling system. It's the glutes. Some have them bigger than others, right? But here's where we propel from. It is a source of power. It is the way the creature creates its anchor. If the hips are gone, the creature doesn't survive. So when we look at this and we look at someone who was an athletic person when they were young, Mario, and all of a sudden they get this job where they sit in front of a computer. They don't go out. What happens to them? They become decalibrated. Like a car, it doesn't get used. And before you know it, it starts sinking and becoming flatter. And eventually the inner workings that we just came from, really, they start grinding.
Absolutely.
And there's congestion. The lymphatic system is responsible for the circulation, but the lymphatic system, unlike the arterial and venous system, which works primarily with the heart pumping, the lymphatic system is functional by what? Motion, by using it. So when you sit,
it's
swell.
A pump. You know what, Alex? It is the sacral occipital pump, baby. So when you're talking about the CSF, cerebral spinal fluid, I can tell you right now, when that sacrum is not pumping back and forth, when you're walking,
yes,
and all of that, you know what? It stagnates the flow all the way to your brain.
It does.
It does. To your brain. And then the area that you talked about that I think is critical, you've got to keep the body moving. We are created as bipeds. Bipeds. We're not walking. We're not gorillas walking on our all fours. I know sometimes you feel like one, but we're not apes. That's right. We're not silverback apes. The thing is, we're bipeds. So that means the whole body has to align and stand up. And that's where core, Alex, in every sport, I tell people, I'm really impressed with your biceps, but your core sucks. You know what? Your core determines your overall function. That is where you keep your body upright and you create that calibration in your spine. Once that lordosis, that lordotic, that curve into your back, once that is totally lost, you're actually degenerating. You're aging. Yep, there it is right there.
Yes. So
you see it?
Let's go ahead and take a look at that right there.
Yeah.
That's the lordosis you're talking about?
Yeah.
Wish I could get rid of those lines. But if I knew how to do that, I'm not going to, it says clear, deep
Clear.
I don't know. Draw screen.
What do you do?
I don't know. I don't want to mess with it because I don't want to mess up things.
Can you draw the lordosis out?
Yeah.
Wow.
Oh, Mario, you just
That's crazy. Wow.
The best
We're
thing.
getting nasty with this,
pen.
Alex.
Oh, look! I found clear
you
pen.
did?
Clear pen. Got it.
Clear.
Okay.
So
here. So
can you rotate it?
Okay. Yeah.
Can you
sure.
rotate the
Sure.
body?
Yeah. I can.
Right there.
See
Right. Ooh, stop.
there's
Right
the
there. Right there.
lordosis right there.
And then do the pan. Do the pink pen, Alex.
The pink pen. We got the pink pen right here. So
right there.
Looking at that lordosis there.
Yeah.
That curve, along with this curve, makes a big difference.
Yep.
Okay. So we ultimately understand that's nice now that I learned how to work this thing.
Nice.
Right? No, I got this clear. I got to take care of my pen. Get out of there. So what happens is you end up understanding that this sacrum or this glute area really influences a huge, vast area. What I've learned in my practice is that when you have a person with a sciatic issue, okay, there are upper back issues.
Absolutely.
There are shoulder issues. Now, if the low back and the
throws everything off.
Everything.
I mean, come on. It's like a domino effect.
Yeah. What do you think about when they tell you, hey, the person only hurt their low back and this is a work-related job, and similarly they say it's only related to the back, yet they come in with leg pain and arm pain, and it makes sense to us, but nobody wants to understand that.
Yeah. That's because they don't want to, Alex.
That's right.
They want to lie. It's called lying. Remember whenever mama told you, you're lying, boy. You're lying. Yeah.
They're lying, people.
Yeah.
They're lying.
I'm gonna take you in the bathroom and wash your mouth, boy. Yeah, Alex. That's right.
They're lying. You know what? Why don't we just say it for what it is? They're lying. They understand.
Right.
They don't get the concept that the body is a biomechanical chain. And if the hits affects the hips, it starts affecting the low back, which then affects the upper back. And everybody knows if you got a back that's given up, you got shoulders that have issues. If you got shoulder problems, then equally on the opposite side of the realm, you're going to have knee issues. So what happens is, as we look at this dynamics, Mario, we really, really see that we can't be telling a fib here. Okay?
No. I mean, again, the body, the spine is one unit composed of many segments. Okay? It's not separate. It's one unit composed of many segments. So there is no way that you can have an injury to one part of the spine and you can tell me 100% that it does not affect any other one. It's impossible. I'm sorry. God didn't create it. If you want to see here, look at this latissimus dorsi. Okay? Look at it goes all the way across. Look at this one. This one is amazing. I'm just going to do this. Here's the muscle right here.
The trapezius.
There you go. Now watch this. It goes from here. Hold on. It goes all the way to where? The shoulders, all the way down. Here we go. Bam.
All the way there.
Now look. There. Bam. And it goes all the way from the neck. Hold on one second. All right. Look at this. The back of the head, y'all.
Yeah.
Okay. The back of the head. Okay. It goes all the way there.
Let me go ahead and remove. I'll remove that for you.
Yeah.
Go ahead. I'll hit
if
this
you can
and then
clear it.
that. Okay.
And then can you move the body down?
Yeah,
like,
sure can.
Oh, sorry about that.
Yeah, sure can. Let me go ahead and take that.
Yeah.
Let me take control.
Yeah.
And then when I got that done, okay, then this kind of takes a little bit of dexterity here.
So I just want to show one example. No, a little bit so you can see all the way the base of the head.
Okay. Hold on. I got you.
All right. I'm just that's it, Alex. Whoa.
Right there.
Oh, no, too much.
Well, here's what you want to show. I think what you're trying to show is the negative muscles and seeing all the good stuff that's in there. We need to show this a little bit better that way. You got that? Is that what you want to see?
Yeah, but I want to show you just that top
layer.
Trapezius.
Okay, so let's go muscular.
So it goes all the way from the base. Can you go out so you can see the whole thing?
Sure can, right there.
Yeah. Okay, and lift him up.
Oh, I wish I could. Oh, there we go. Okay.
Yeah.
There we go.
Okay. So now here it is. This is how dynamic this is. So when people say, "Oh, you only hurt your neck but not your mid back," here it is. Trapezius right here goes from the base of the skull all the way down the shoulders, right there, all the way down to the mid back. Okay, and this is probably T T10, T11, right? Somewhere around there, right? Like mid, and then all the way up and across. So this whole area right there, that's one muscle.
Right, it sure is.
So if you have an injury here, got a little crazy. So if you have an injury here, right there in this area, right there. So if you have an injury here, this will affect all the way here.
Absolutely.
It will affect all the way here, and it will affect all the way here. So now, what color's the red bus, baby? I don't know. It ain't blue.
That's right.
It affects. So that's what it's amazing how overlap. And then if you go in deeper into like the second and third layer,
let's do that. Let's do that. Let me go in there.
Now it gets really crazy.
Okay, go ahead here. Go ahead and close this thing up. Done that, and then when we start removing muscular layers or increasing muscle layers, you start looking at.
Oh, look at that! Look at that! Unbelievable. The rhomboids right there. Look at that. The supraspinatus, infraspinatus. I mean, wow! And look at this right here. What is that one? Levator scapulae. So here's from the shoulder all the way to the head. And scalenus capitis. I mean, I love this stuff.
Okay, so what we're looking at here, we're looking at the umbilical body, but let's go back to the area of concern. So we have to.
Yeah. Sorry, you see how connected it is, Alex?
You know what? Here's the story.
Yeah,
Mario. Here's the deal. Okay, you and I know. Okay, that the whole darn thing is connected, right?
Yeah.
After dealing with the many patients we've seen over the years,
I love this.
You know what? We can actually determine what is actually going on. And we're like violin instructors. We touch the violin and we make this body move. Our job is to get an understanding when someone comes in and physically see where this problem is. Find out where the issues are, and there's tons of issues, and we haven't even begun. We're just having a general conversation about sciatica and where the issues are. What we don't want is we don't want surgical intervention at any early stage, unless it's really necessary. Now, what we're looking at is when we see this, nobody wants that. So how do we fix this? So there's tons of ways to do that. So
can we go back to the slides of the causation for sciatica?
Absolutely. So
I love that.
I'm going to take you back to the causation.
Yeah.
Let me get over there in a second. Okay.
Yeah. Because I don't have that one.
So the causation's right here. Okay.
Okay.
Whoops.
Right there. Bam.
And not yet. And they don't see that yet. So now they're going to see the causations.
Okay.
And we are now looking at causations.
Look at all that. Amazing. First one is compression.
Compression of a disc. Okay.
Compression due to, you know what? Lack of calibration, balance within the system. So you have uneven compression and then a lot of sitting down. We talked about that, right? And then inflammation. Again, inflammatory process. We talked last week about what? Metabolic syndrome, inflammation. Inflammation affecting the whole body. And then the disc bulging, number 2 right there, number 2, disc bulging, that one, again, is due to what? The spine being out of calibration, out of alignment, putting uneven pressure, and it's just like squeezing a balloon or a donut. That's a classical example. You put pressure on a donut on one side, that
cracking.
jelly is going to crack. It's coming out, and that's you go from disc bulge to worse, herniation, and then fractures. Of course, if you have like trauma, DDD, that's a funny thing. Degenerative disc disease.
Yes.
Right.
Early degeneration.
Right. And then I love it because most people come into my clinic and go, oh, I have degenerative disc disease, like I'm getting old. I'm like, no. You know what? You've had no maintenance on your back.
Right.
You're not old. If you would have taken better care of your body, you wouldn't have degeneration. They act as though it's normal. It's not normal. It's just a sign of the breakdown.
The magnitude of us uncovering or discovering where a person has an issue, all of these things have ways that we can help it. And what's crazy about it is that we have to go against the grain in the methods that we do, because you would not think of exercise would be a useful tool. right, for this. However, exercise is one of the best things for it. We have to calibrate that pelvis if it's appropriate. If it's a herniated disc and it's really, really a bad one, we have to go ahead and surgically remove that. If not, if we do anti-inflammatories, we do natural methods, and we get that body working and calibrating. Sometimes what happens is these people come in, these individuals, our patients come in, and all of a sudden they have a pain that just creeped up on them over the last couple of weeks. Sometimes they have an anterior listhesis, a slipped injury, a slipped disc, or even a vertebra that's been fractured for years, and now it presents with the issues. Sometimes it's a neurological presentation. Sometimes it's a metabolic disorder with a metabolic syndrome. They have inflammatory disorder. But what I've noticed, and I'm sure you've seen too, is that these people who have sciatica live with this looming monster. It's almost like a snake that lives in their pants, and they just kind of, when it bites them, it gets their whole leg. It totally disrupts people's lives. Figuring out what the cause is very important. So as we go over these things, I mean, it's important to go over the regions. I've even seen patients where they come in thinking it was sciatica, and sure enough, it's sadly, but it's a tumor. And in that situation, we move on it quickly. I got to tell you, in the situations where we've had great teamwork and really resolved a lot of issues for a lot of patients.
And that's the beauty of how we think, Alex. We think in terms of integration. So again, just because you have a hammer, everything doesn't look like a nail, okay? And again, we are chiropractors, but at the same time, we are physicians. And what that means is that we have the knowledge of physiology, anatomy, neurology, all of that. So we have the ability to understand that the pain, the sensor, is not the problem. The pain, sciatica, is not the problem. We look for the causation of the problem, Alex, the causation, and that is, in a lot of ways, the misalignment, the compression, the inflammation, the disc bulging, again, bone spurs. And a lot of times people say, well, I have bone spurs because I'm getting old. No, bone spurs are created because there is a misalignment and a lack of calibration in your spine where the body is attempting to self-regulate, self-align, and it's called Wolff's Law. You know, it's actually law. It's the same principle that deals with a fracture, healing fracture. Where you have pressure, that's where you have increased calcification. Alex, is that correct?
It's the same thing when you work out. When you work out, you get calluses, right? Mm-hmm. Because the body responds to stress by increasing and protecting the tissue. The same thing happens with the spine. If it starts unloading improperly, then before you know it, the Wolff's Law kicks in. The osteoclasts start losing, which are the ones that take away bone, and the osteoblasts start winning, and then you have an increase of bone growth in a direction, usually in the direction of the force. So in essence, the body tries to protect it. So you can imagine
self-calibrate.
If someone's going like in a leaning tower, well, it's on this side that the body protects it to prevent it from falling over. So in essence, as we look at these degenerative diseases, we try to get it early on, and we try to mobilize. And in most scenarios, we can clearly help the individual by different methods and different techniques. And we use a lot of different methods and techniques to help individuals through this process.
I just want to go through a couple of points. You know, when we're talking about spinal stenosis, again, that the start of spinal stenosis is misalignment of your spine, which chiropractic has the beautiful art. This is the art and science of correcting that. So the more alignment, the more clarity, the more balance you have in your spine, the more maintenance you receive to your spine, the less spinal stenosis you will have later on in your life, or you know, again, spondylolisthesis. You know, the other one that we're looking at is degenerative disc disease or disc herniations. I really believe that in the 25 plus years of my practice, I look at the body. The better maintenance you give your body, the less issues and the less breakdown, wear and tear you will have later on in your life. So I look at it as that we are anti-aging doctors in terms of biomechanics. So we help the body maintain its optimal function for a longer period of time. So that way when you're in your 60s and 70s and 80s, you can walk by yourself without a cane. You can function. You can do a squat. I love fitness calibration. Every time, Danny is awesome with push. Danny is tremendous in terms of fitness, core, and this is where the synergy comes in. The more miles, the more wear and tear, the more pounding you put on your body, the more maintenance you need, the more recovery work.
Yeah.
Okay? And too many people, Alex, they have this idea like, oh, my back hurts. I just need to squat more. I just need to do more weights. I just need to be in a gym more. No, it's like me telling you I don't need maintenance and tune-ups on my car. I just need to drive it more. No. So the more miles you put on your back, the more you squat, the more calibration you need. Why? Because eventually your body is going to go out of alignment.
You know, as we look at disorders like you said, spinal stenosis. I mean, there's a lot of reasons that we can have spinal stenosis, from a disc to actually just arthritic issues. But when we have an individual that all of a suddenly just has issues, okay, this is not a sudden, kind of thing that the spinal stenosis doesn't happen unless it's a massive disc herniation that happens at one moment.
Yeah.
But these things, and what we're talking about spinal stenosis, there's different reasons, and the treatments are, many methods are just, micro discectomies. There's also laminectomies to remove the pressure on. But bottom line is, there's very little wrong with the nerve. The issue is compressive forces. So what we have to do is, in the situation where there is, most of the time, it's a biomechanical imbalance in the pelvic girdle.
Yeah,
so,
structural, right?
Structural, yeah.
So,
and
so
yes.
the structure impedes on the nerve.
Yes, and as we do that, as we evaluate that, there's certain things like age, obesity, even less of a life of activity. What other things, Mario?
Sedentary lifestyle. Occupational repetitive motion.
What kind of occupations would actually have sciatica? Give me an idea. Just give me just let
How
people
about truck drivers, baby?
Why? Vibration.
Sedentary.
Vibration,
sedentary. 8 to 10 hours sitting down. Secretaries. I mean, you can go on and on. I mean, people working in banks. I mean, teachers even.
We have patients that go to the Southern Union Railroad. The engineers, the vibration, the bouncing, over 30 years of vibrating, eventually the bone activates, the spine occludes, or you have spinal stenosis, and they have back disc issues, and they have degenerative disc disease.
Yeah, so athletes, repetitive torque, like a golfer. How many golfers do you know that have no back pain? None. How about
that brings up a good point.
How about baseball players?
How about our buddy Tiger Wood?
What happened to him, baby?
Yeah, well, people thought he may have been having some issues with alcohol, but the reality is he's taking medication after a surgery, and all of a sudden he's driving, and he probably forgot to take they took a pill extra, and then you have them all over the news.
Opiates.
Yeah, and this is the issue. We got to figure out how to fix these issues, calibrating. But I got to tell you, there are a lot of ways we can help people. So the issue is once we understand where the problem comes from, then the plan of attack can take off. There's different issues and different types of diagnoses. We have here a little bit of a window. You can actually take a look at that. You can actually see that these are just sciatica is a symptom. It's a presentation of syndromes. It's pain down the leg, but there's tons of reasons. Now
the causation is right there.
Right.
Look at that.
Well, look at all these things. Look at all the things that we're looking at.
DJD.
Radiculopathy.
I mean, wow.
The one people think about a lot is piriformis syndrome. That's only one component. Yeah, and then when that doesn't work, your little stretches, then you try to figure out what's causing it. It could be a tendinopathy. It could be a bursitis. It could be, look at all these issues. When we go in here, when we look at these particular issues, you can look at other subsequent areas that are causing problems. And this is the what you mentioned before, the facets, disc degeneration, radiculopathy, the quadratus femoral area. So
let's make this simple. Otherwise, people are going to listen to us and go,
It's a lot. It's a lot.
This is like a fire hydrant, and I just have my mouth over it. Alex, this is what we got, okay? This is what we got. Number one, it all comes down to foundation and function, right? If we go back on each one of these things, all the way from facet syndrome, disc degeneration, radiculopathy, hip, ischiofemoral impingement, quadratus femoral, abnormalities. All of these, the root of all of these is what? It is misalignment and lack of calibration of the neuromuscular system. I mean, when you go down to it, the majority, I'm not saying 100%. Let's not do that. Let's not be silly tonight.
Nothing's ever always and
No,
never.
it's not always and never. The point is the majority, if we can do a better job for our community, if we can do a better job in terms of our athletes, okay, to create a maintenance calibration system for them, we would decrease a lot of these a lot of these diseases and diagnoses.
Yes.
We would stop them before they blow up in their face.
Let me ask you this: what kind of things, in terms of our diagnostic abilities, what we use different methods to diagnose the area? Okay?
I love MRIs.
I believe
I love it.
In terms of sciatica, X-rays are good, but MRIs
Come
can
on.
actually tell you where the problems.
That's it. And we're talking about like a Tesla 10. I don't know if they have it. I think it's, sorry about it. I just got crazy tonight. Nah, they didn't make it. We're going to get some calls. Tesla, what?
You know what?
What?
We got really great radiologists out here, and they help us really hone in on a particular area.
They have a 3? What is it? A 3.0?
Well, I know 2.0? It's a 6 point something.
6?
So
all right.
the whole idea is the relationship that we have with our radiologists. Our radiologists are our eyes and ears in the deep tissues. I can tell you that we do have the best radiologists working with us. We really do. I mean, the city has some really top-end radiologist people, and when we send them to them, they communicate with us and tell us where the problem's at. From there, we go at it. Once we know where it's at, we use CAT scans, we use ultrasounds, we use bone scans.
Why is it a question? Okay, this is going to get a little crazy and a little nasty tonight. Why is it that most doctors, Alex, order X-rays first? Why is it? I can never understand. For myself, you know what? I try to go straight to the issue.
There's two
reasons. Go to MRI. Why is
reasons.
it?
One,
I always ask
the standard of care is usually, many insurance carriers will kind of want an X-ray first to see if it's a degenerative, a bone structure, to be able to blame on that. But we all understand that the best possible option for actually assessing it and to kind of ruling out some things. If you want to look at bone, you do a CAT scan. If you want to do the soft tissues, well, this is a soft tissue, so then you do an MRI with contrast, and you can actually see the deep tissues and the separation, as well as the inflammation for any prolonged issues that are occurring.
That's why, to me, Alex,
that makes sense.
If we're looking at diagnosing disc and nerve issues, right? Mm-hmm. Right? Why is it that we use an instrument a lot of times, and I see this, and I totally agree with you, a lot of the insurances are going in saying, hey, you need to do an X-ray first. We won't let you do the MRI, do the X-rays. I'm like, yeah, but X-rays don't show any soft tissues.
No, and I think it's a common thing. It's just almost like when you go to a dentist, they scan all the teeth. It's to generalize. There are times when the standard of care is that, and today for low back, the standard of care is an X-ray as an initial entry point. So from there, you can actually, and I've learned, and I have gotten this lately, that most insurance carriers are very open to allowing the individual, based on presentation, to do whatever it takes. They don't stop us anymore.
Nice.
That's a whole beautiful change that's happened since, I'd say, for the last 5 years. It's a whole different game. So we do get to see that. We do nerve conduction testing, nerve testing to see actually the speed at which the nerve pulses. So we can find out
EMGs, electrical myography,
to see how the muscles are. But you don't need to be doing that stuff for a sciatica when you know the person's in severe pain. Now, if you want to prove it, well, that's when you do the NCV. Other than that, the person's not going to come in telling you that they have pain. Now, sciatica, because I call it the scourge because it just annoys you. It stops you from doing it. You don't sleep. You get to lay on it, and the darn thing just activates, and there you got this electric current preventing you sleep. People come in with their eyes bloodshot and unable to enjoy their lives. This changes quality, and we need to fix these things. And as we do,
it affects families, Alex. Let's get down to it. You know what? It affects your relationship with your spouse, with your children, at work. You go to work and you're angry.
Yes.
You're just angry at the world, and people are trying to figure out, like, what's wrong, man? And it's like, you know what? I'm dealing with stuff. And then that chronicity, after a while, you're like, you know what? I don't know what to do. I'm taking too many meds. I'm taking 800 milligrams every day for like 5 months.
Let's give someone out. Let's give the people out there that may be wanting some information a little bit of insight into the other options that they have. Because what's the name of the game here? What is sciatica? Inflammation. It's what it always has and always will be. So what we got to do is we got to do what we can. And a lot of people ask me, well, what are my options? Well, we have here a breakdown of certain things, and we're going to discuss these things in real big detail over the next couple of months. And we're going to hit this thing. We're going to be dealing with sciatica and vitamin C, D, calcium.
We're going deep.
All these things. You can take a screenshot of this, and you can say berberine. We got glucosamine, chondroitin, acetylcarnitine, acetyl alpha lipoic acid, ashwagandha, soluble fiber, vitamin E, green tea, turmeric. A lot of these things have a lot to do with metabolic syndrome. But guess what? When you have metabolic syndrome, which is it's inflammation, it comes back in. So what we've noticed, Mario, and correct me if you've seen something differently, because
I love that word, ashwagandha.
Ashwagandha.
Yeah, I love that.
Yeah, it's got some sounds kind of like Rolanda.
Yeah, feels like we're gonna meditate pretty soon, Alex. Yeah.
So as we as we kind of look at these options, we really can discuss deep levels of biomedical science here. Okay, because everyone wants to know what we can do. But since we're dealing with, let's say, just on the angle of metabolic syndrome, again, we got to tie in another beast. Insulin, inflammation, susceptibility. And here we have a correlation. It may seem far away, but it really is. A person, if you take 100 people with metabolic syndrome, these people are susceptible to sciatica. And the studies
hold on. Let's make it simple. How many people do you know that have metabolic syndrome that don't have back pain or sciatica? Okay, let's make it simple.
Yeah.
How many?
We got to tie it together, and this is where we do. And actually, in clinical practice, what we do is we actually make these connections. And bottom line is we start changing people's habits. Simple things like instead of having a pop or some, only option you should have is green tea. Green tea. Green tea is an antioxidant, anti-inflammatory. We start changing the metabolic process, start cutting the gut grease, and all that starts happening.
Gut grease.
That
is. Okay, we're mixing ashwagandha with gut grease. You know what? People are going to remember this forever, Alex.
If you kind of see what we're at, we're saying it is complex. It is complex. We can go down one rabbit hole and say we got the moment of truth or the thing that's important. But the reality is that the low back causes neck pain. Well, a lot of people will look at it and say, why does that happen? Well, like Mario said, what? God didn't name it neck. God didn't name it lumbar spine. We named it. It's the vertebra column. It's the whole darn thing is connected. From the moment you heel strike, your head feels the shock wave, right? So when we look at that, when we assess that, we can see that the body has a massive implication when some large nerve, like the sciatic nerve, gets offset. So what we can do is first figure out, mitigate the issues, control it, and come up with a treatment plan that works appropriately for the patient. So as we kind of do these things, we're going to go over all those beautiful ideas that we have going on here. And I just wanted to at least let you know that we're going to be discussing many more subject matters.
Vitamin D. God, there it is.
I
love vitamin D3. It's everywhere.
400 disorders. Actually, a 400% as well. Decrease in all risk mortality. 4 times decrease disease mortality with vitamin D. This is like the magical thing. I mean, common sense.
Yeah.
I mean, what's our biggest organ, right? It's the skin, right? So when we live in the sun, right, what happens? We absorb
Sun City, Alex,
and that
we
triggers.
Should be the healthiest. Hey, I'm going to get crazy tonight. All right, Sun City, vitamin D. We should be the healthiest on the planet. That's it.
That's why people, sun is, it's important. So, you know what did we get called about a couple of decades ago, Mario? You remember that? We called the fattest, sweatiest town in the country, right?
Yeah.
You know what?
That angers me. That angers me. That should motivate, pump people up. Yep. I mean, that right there should be the wake-up call and the battle cry of El Paso and the whole region. Say, you know what? Never again will you ever open up your mouth and say that, because we are the best.
We are.
Yeah,
we are.
We are.
We are a very family-based kind of location and a community, but we do suffer from metabolic syndrome, and that implicates issues. And one of them is sciatica. And I got to tell you, there isn't a day that half my patients coming in have sciatica, and bam, you and I we've been doing this for 30 between 25 and 30 years, right?
Yeah,
so as we've been pounding,
it's
been pounding and fixing these disorders. And you got to tell you, there are studies where we actually see that when doctors of all different sorts refer for surgical consult, there's a high tendency to have surgical focus when you go to a non-musculoskeletal specialist like a physical therapist or a chiropractor. We kind of filter out the situation. When an allopath or a general physician kind of sees that low back pain, they throw it to the orthopedic surgeon, and only 5 to 10% at most studies show that those become surgical. The ones that we send, about 50% are surgical. That means we do a great job of filtering out before they have that issue. In other words, we fix the issue, and the ones we do refer, they
really need it.
Exactly.
That's the point. That's the point.
Say hello, baby.
Yeah. Yes. That's right. Game on.
So we want to make sure, for your orthopedists out there, that we need that. We need that option, that modality, though we don't do that kind of procedure, but it's necessary. In terms of the treatment protocol, that is the common mainstay of sciatica, it's gabapentin.
And you know what? Just adding on to that, we refer real cases. Yeah. So when someone comes in, they really need it. It's not like, oh, you know what, we're going to waste people's times. They really need it because, again, the new model now for back problems, and especially sciatica, is, again, non-invasive, non-invasive care first for at least, 3 months? 2 to 3 months.
Well, I'm on my personal point of view on those guidelines. Every person's different.
Yeah.
Excuse me.
Yeah. ODG guidelines, Alex. ODG.
Yeah, and what happens is that when we look at these dynamics, you can oversee the treatment protocols, and sorry.
Mm-hmm. Yeah, there it is. The treatment protocols. You all right, Alex? My gosh. Okay, well, that's not sciatica, guys. That's just coughing. You know what? Look at the treatment. Chiropractic care, lifestyle changes, metabolic syndrome. We're looking at physical therapy. Absolutely. We need everyone on board. Acupuncture, drugs, medication for pain, anti-inflammatory, muscle relaxants, nutraceuticals, herbals, steroid injections. Yeah, those are usually what we call like the secondary. Even with a lot of the patients, by the time they get to that phase, it's after conservative care, and then of course you have surgery, surgical, procedures. So, yeah, I mean it's very, very important that you go with our patients. We go from non-invasive to invasive care.
These procedures are the ones we do.
Now with those, and that's a foam roller, right?
That is
foam
correct.
rolling. That means releasing the glutes, the piriformis, right there. And again, a lot of our viewers will think, hold on, I can't even walk. I can't do that. But again, this is the secondary phase, Alex.
That's correct.
Yeah. So this is the secondary phase. Again, we're not getting people out and all of a sudden they can't walk and they're doing box jumps. No, this is the secondary. So first care, correct, release the pressure, break the pain pattern, and then stabilize and correct the muscle imbalance. So those are the things.
Absolutely.
Because I think a lot of times, a lot of people ask me like, oh, you know what, I want to go work out. I'm going, hey, slow down, superstar. Let's not work out.
Exactly.
Let's not work out. Let's correct the problem, calibrate your back, then you work out, and then you do a process of what I call periodicity. That means you scale it. You got to crawl before you walk and walk before you run. So let's not be superheroes. And a lot of people just aren't patient. You know what, Alex? I'll be honest with you.
Tell me a little bit
They're
about
not patient. They want things now. This has been created. The sciatica and back problems has been created for years. No maintenance for like 10, 20 years. And they expect to walk into the office and in one visit do jumping jacks. You know what? Get real. Sorry. Get real, buddy. It's not going to happen. It's not. So that's where people want, again, we do our best, but we don't look for quick fixes. If you want the symptoms to go away but not corrected, then you're going to deal with a problem that's going to be lingering for years and years, and it's going to get worse. And those pain sensors, this is what's so important. God created the body, such a miraculous system. This is like, we can't even duplicate this. I mean, with the largest technology, it created to where the sensors, the awareness, proprioception within our body, and that pain is so important. A lot of times I tell people, don't block the pain. Don't block the pain, because that pain is healthy because it tells you to stop. That pain is that red light on your dash that says, don't drive the car. Don't park it and fix it. Right. Don't unplug the light and keep driving it. And this is where our society and our, immediate care. I want things now. I can't wait. Just like fitness. People want to get fit in like a week. Like, come on.
No, it's not going to be happening.
It's not going to happen. Same thing with your health. It takes time, and you have to get the proper diagnosis. The lab work, intense lab work, the genomics, the inflammatory. I mean, this is like I tell people, you've got to invest in your health or invest in your sickness. Either way, you're going to spend the money. Either way, But one, you're going to enjoy the fruits of that investment. The other one, you're just going to drag. You're going to drag. So the process of diagnostics, all the way from MRIs, the process of diagnostics to look at metabolic syndrome, to look at your inflammatory process, that's an investment. And then with those tools, with those information, that baselines, you got to create baselines, Alex. If you don't know where you're at, you don't know where you're going. Now, that's what I would say is really, I want to motivate and empower people to invest in that process, because it's not a overnight thing. And people want it, but I tell them, no, you've got to understand, be disciplined, be relentless, and see the results for life instead of patching up your health.
This is very dear and near to all of us here, because sciatica affects so many individuals. We're going to be discussing all these issues one section at a time. We're going to bring an explanation. We're going to give you an answer. We're going to give you options. We're going to give you treatments. We're going to come up with a way that we're going to find the best possible treatment protocol for you. And if not, we're going to give you at least a basis to ask your doctors exactly what the best approach is. And you're going to at least know the different directions you can take, because it's very important that we understand this disorder. It may be simple to many people, but when you have it, it actually debilitates you in a great way. We're going to bring this to you. If you ever want to ask us personal questions and call us personally, I know that Mario makes himself available 24/7. Mario, your phone number is 494-4468. It always has been. And he gets called all the time, as he is right now. My phone number is 850-0900. And here we have Mario. And I want to thank you, Fall, for giving us the opportunity to go over these things. This is Mario's number. And there you go. It's 494-4468. You can see it. It's public. He makes himself available. He's got the RujaHealth.com. It's an amazing site. We got myself over here. This is my address and my phone number.
Yeah.
My personal number is 494-4468. That's Marius.
Yeah. There you go.
Again. And then there's Danny Alvarado, where we work here at a Push Fitness Center, and we actually see what's going on. So we welcome you guys to seeing what's cooking here and seeing what's happening, and we wish you the blessed. Everything that's happening. So as we go through that, Mario, it's been a blessing, brother, and I look forward to going over more details with you in the next couple of days, and we will start recording more and more as time goes on. God bless.
Thank you, Alex.
Thanks, brother.
I actually got it.